much to Dr. Narayanan. We are now going to move on to our next speaker. We have Dr. Dieter Pfoser. He is the chair of the Department of Geography and Geoinformation Science.
So good afternoon, everybody. Microphone is working, I hope.
Mm-hmm.
Good. So I'm not only chair, I'm also a professor at this department. So Geography and Geoinformation Science, what we are doing, at least what my research group and a couple of fellow faculties are doing, we are working on urban analytics. So we try to solve urban challenges based on the data sets that are available to us. And there's a lot of data available, and there are many, many challenges. Why urban is important? Well, that's because most of the people live in urban environments. And think of Washington, D.C., the Washington, D.C. metro area, with its 2.4 million people. Now, the particular effort I'm going to talk here, and I called it Hack and Urban Mobility COVID Edition, is actually a hackathon project by a group of grad students who will be presenting this work today, actually in the afternoon, towards a panel of judges and their finalists, and hopefully it goes well and they're going to get a huge prize off of that. So I'm just posting also the link to the event in the chat. If anybody wants to join, it's open to the public, so you can just listen in. For example, Senator Warner is speaking at the event as well. So it's high profile. So next slide, please. So this particular project, hey, the animation works fantastic. So this particular project is about traffic. And as we all know, traffic is bad, or at least it used to be bad, right? So going to Washington, D.C. at the wrong hour of the day was really, we didn't like to do that because you're just stuck in traffic for hours on end sometimes. And COVID came along and suddenly everything is, traffic is not as bad anymore. Public transport essentially is hardly used at all. For example, the metro, 95% drop in passengers. Nobody uses the metro. Metro buses, nobody uses the buses anymore because just there's a fear of, crowding and getting infected. So next slide. So every day, literally now is like 5 o'clock in the morning, you can get on the road and it's fine. And a big reason is because we are all working from home, right? So we spend, like we do now, we spend our time behind Zoom, behind monitors on Zoom meetings, and we don't really have to go to work. And so this change, this fundamental change in work habits has really had a profound impact on transportation in the DC metro area because people don't need to commute anymore, at least for the time being. And one of our assumptions is, and that's next slide. So one of our assumptions is that some of those trends, because we have new work habits, are going to persist post-COVID. So the expectation is that our work habits post-COVID are not going to be the same as pre-COVID. And we, folks might be, that's too quick. Folks might be able to work from home, for example, for 1-2 days a week. And so the big question is how it's going to affect traffic. There are other things like people might not use public transport anymore because not using it for 1 year, you kind of are not in the habit of using public transport anymore, and you just might take your car, or you might use micromobility solutions or bikes and so on. So there are many, many things that will change when it comes to transit. And the question is, how can we kind of try it out? So how can we kind of reason about post-COVID scenarios in terms of transportation? Next. And our answer to that is really doing microsimulations. So what in this particular project is we do large-scale agent-based modeling using a platform called MatSim, and using data about the population to parameterize the simulation. So essentially what we create is a digital twin of the DC metro area with its 2.4 million commuters every day, and trying out different mobility solutions. So as I mentioned it before, what would happen, for example, if folks would work from home, or a certain part of the population would be able to work from home 2 days a week, right? What would the impact of this be on transportation and on traffic in the DC metro area? Right now, nobody knows that, and we hope to have an answer for this one. Next slide. And a concrete example here is everybody uses different transit or transportation solutions. And not everybody actually has access to a car. So there are areas, this is Fairfax County, so the areas in the county where there's a high percentage of people actually using the bus. And we saw in our data set that using the bus is directly related to income levels. So the lower your income, the more likely you're actually using public transport, or I have to say the bus metro usage is actually independent of income. So everybody uses the metro. But buses are really focused on more the low income population. So now budgets are tight at the county level, and there is talk about reducing the level of service of for public transport, so cutting bus lines, thinning out the schedule of buses. And one thing you don't want to do is you don't want to take away buses or the bus frequencies or for parts of the population that heavily rely on that, right? So this is a concrete challenge that the county has. And the question is, so which buses can I reduce because they're not used? And which bus lines do I have to absolutely maintain at the level of service that I have right now? So and this is to guarantee transportation equity, as it's called, and to avoid transit or transportation deserts. So this is a concrete scenario that the county is looking at, and our simulation actually will have an answer for that for post-COVID, for various post-COVID scenarios. Next one. So you might ask, so what? So one thing I mentioned, avoiding transit or transportation deserts, safeguarding vulnerable population. So folks that actually already struggle to make an income, to make a living, you cannot take away the bus. Otherwise, how would they get to work, right? So those are all very, very challenging problems that somebody like, the Fairfax County as a local authority has, because it's a 1.2 million population that lives in this county. So, and giving all that with budget constraints. So the money, the income, the revenue is taxes are gonna drop, and so the spending is gonna drop for the public sector and for local authorities. And the question is, where can you make cuts? And yeah, so those are all very interesting scenarios and questions, and hopefully the county will pick up on that and is interested in the work the students, so Dan Cheng, Shi Fei, Tunajina Khan, Xi Yang Ran, and Meng Fei Jin are doing. So if you have the time, please join the team tonight at the presentations, and hopefully there is time or there's a reason to celebrate later on because they've won a prize. And that's it for me. Thank you very much.
Wonderful. I did see one question come through. The question is it possible to extrapolate this platform to figure out the dynamics of how a virus would spread in circulation? Kind of think of the virus as the yellow line that takes the metro route, AKA blood vessels. Is that possible?
Yes and no. I mean, the problem is that, it's people, it depends a lot, and there is, other folks working on that. It depends a lot on the behavior of the population, right? It depends on whether people wear masks or not, whether they keep social distancing guidelines or not. So those are all factors that they play a much more important role than being on the same bus with somebody, right? So to give you an example, for example, my son, he's at UVA, and he was isolated because of, some of his friends tested positive for COVID, and he has been around those friends for hours on end, and he never got COVID, right? And he was really close to them, so he never got infected because of that, and neither was any of his friends. So out of a group of 10 people, 2 were infected, but they didn't transmit the virus to anybody else. So it is much more complex than just being close to somebody for 15 minutes, but you can contract the virus. Of course, transportation plays a role, but it is not that simple. Let me put it that way.
Great. Thank you so much. Really appreciate you letting us in on some of the things that you're currently working on.